Welcome, everyone. Thanks for spending some time with us today. This is the Catalyst Solutions Medicare Advantage Prescription Drug Enrollment Eligibility webinar. We're excited to present this to you today. And today we have a special guest speaker named Richard Dick Warren. Richard is recognized as an expert with over 25 years of proven experience in health plan finance, operations, and IT, focusing on Medicare Advantage, Medicaid, and government-sponsored health plans. Dick spent 15 years as both CFO and CIO at a 400,000 member Medicare Advantage plan, and then as a COO at the regional provider-owned health plan. He then moved to the vendor side as executive at a Medicare Advantage enrollment and revenue management software company, and for the last 7 years has been a consultant helping health plans with revenue management and financial reconciliation, regulatory compliance, star ratings, health plan operations, and risk adjustment and factor assessment. His primary focus has been on business transformation and process improvement, with an emphasis on proper application of technology to leverage automation to make business operations both more effective and more efficient. Dick's passion is strategic planning and tactical implementation of solutions to address the challenges of the highly regulated and increasingly competitive government-sponsored health plan environment. And with that, Dick Warren, will send it over to you.
Hello, and welcome to our webinar for Medicare Advantage Enrollment and Eligibility. As Joe said, I'm Dick Warren. I'm one of the executive advisory consultants at Catalyst, and I focus primarily on Medicare Advantage and Part D plans. Today, I was going to talk about enrollment and eligibility, and one of the main distinctive features of Medicare Advantage enrollment and Part D enrollment is that it's a three-way transaction. Unlike commercial plan enrollment or ACA enrollment, it's not between just the beneficiary, the member, and the health plan. You have to include CMS. And all transactions for Medicare eligibility and enrollment need to be sent to CMS, and they need to be confirmed by CMS in order for the member to actually transfer to the Medicare Advantage plan. So that communication with CMS is critical in order to process this Medicare Advantage enrollments accurately and correctly. Also, a Medicare Advantage organization, you're a federal contractor. You have a contract with the federal government, with CMS, to do Medicare Advantage. So CMS requires the MAPD plan to reconcile their enrollment and member eligibility with CMS on a monthly basis. And then now, it used to be monthly, but it's just changed to quarterly. The contracting plan is required to send a certification of Medicare enrollment reconciliation signed by either the health plan's CEO or CFO, is sent to CMS, confirming certifying that reconciliation has been done. And then the thing that's important about Medicare or any enrollment really, but in this case specifically talking about Medicare, is processing enrollments is a transaction function. It's an administrative function. So it goes into the medical loss ratio calculation as an administrative expense, and it's a processing function. There's very little user or beneficiary interaction required for processing enrollments. It's more aligned with processing claims. It's a heads down transaction processing that needs to be done as efficiently and effectively as absolutely possible. We also need to be sure that the transactions are all processed following CMS regulations, because Medicare, of course, is highly regulated, and the enrollment process has to exactly follow the CMS guidance and regulations to be in compliance. And then, of course, the guiding principle for all plans needs to be the Medicare beneficiary experience. We need to provide quality experience and make sure we're delivering the healthcare services to the Medicare beneficiary accurately and timely. So there are a number of challenges related to Medicare Part D enrollment and eligibility that the health plan needs to constantly deal with and address and make sure they have the processes in place to mitigate the challenges that are presented. Because the first challenge is always staffing, the human resource challenge. We absolutely need to have competent, skilled Medicare Part D enrollment processors and specialists that are doing this process. Our processors need to be adequately trained. They need to understand the regulations that they're following. Those of you that are familiar with Medicare Advantage enrollment know that the Bible for processing Medicare Advantage and Part D enrollments is Chapter 2 of the Medicare Managed Care Manual. That our staff needs to understand that. They need to know it. They need to be trained on it. And then they need to be compensated based on those skills. So this is, a specialist task. We can have processors at different levels up to specialists. And the more we automate the system, then the more we're just dealing with exceptions that can be more specialists that we can pay more competitive salaries to, because we don't need just clerks that are handling the paper. The system, an automated system, can do that for us. And then, of course, we always need to keep our staffs motivated and happy doing what they're doing and providing the processes, the systems, the support from senior leadership to retain those employees, because that's critical in today's workplace. Everyone is experiencing that. We do need to measure their performance. This is, like I said, a transaction processing task in the company, in the health plan. So we need to get these enrollment transactions, these enrollment applications processed quickly and accurately. And because, again, we have to be in compliance with the CMS regulations. So maintaining those skills and making sure our staff is adequately and appropriately trained following those regulations is critical, because they need to be current, they need to understand the rules, and they need to be able to get these transactions done correctly. Of course, the other challenge that I mentioned earlier, one of the other challenges, budgetary. This is an administrative transaction process within the health plan. So these administrative expenses need to be covered in our non-medical expenses when we do our Medicare loss ratio calculation. So there's not a ton of money here to do this, and we can't afford to spend more money than we absolutely need to process these Medicare enrollments timely and accurately. We're still dealing with absenteeism. I think that's starting to get better as we move out and away from the whole pandemic experience that we've all had for the last few years. But we're still encountering absentee issues, which we need to keep people, happy and at work, so production stays up there where it needs to be. One of the other challenges budgetary for expenses is that the complexity of the CMS regulations requires a skilled and experienced enrollment operations team members that I talked about on the prior slide. And so we need to secure that level of talent and provide the training to those people that will increase costs. So as I'll talk a little bit later, the more, like I said, we can automate the processing of Medicare enrollment transactions, then we need lower cost clerk staff type people on the team, which means we have more money available to adequately compensate the higher skilled specialists that are resolving the problems that our automated system can't figure out. So we're just dealing with the exceptions and the errors rather than just manually entering the enrollment applications. And as I was just saying, this last bullet is talking about technologies to support that. And there are systems out there that do automate the enrollment process. There are outsourced vendors that can handle it for you as well using state-of-the-art technology, which for many plans is important because the cost, as you know, of supporting or implementing or maintaining sophisticated technologies can be expensive. And if you're not a very large plan, the economy of scales may not match up for budgetary purposes. One of the very first challenge that a health plan will have, a Medicare Advantage health plan will have with processing Medicare enrollments, is that Medicare enrollment requests, which is the enrollment application, comes from multiple sources. And so that your system and process needs to be able to receive these applications, enrollment requests, timely, quickly, and process them accurately within the system. And enrollment requests can come from multiple sources. If you use sales agents, you have sales agents directly submitting enrollment applications to the plan. They may be doing that. They may be paper applications. They may be directly in a sales agent portal that has been established, or direct connectivity to an enrollment system. But one source, and in most plans that are using sales agents, the primary source of applications is coming in from a sales agent. Also, more and more, we're seeing plans have member self-enrollment available, where a Medicare beneficiary can go to the health plan's web portal, may be hosted by the web portal. It may be a contracted portal that has all the health plan branding on it, but a member can log in to the Medicare health plan that they're interested in purchasing in their area, select the plan they want, and actually enter their enrollment application online through the health plan portal. More and more, we're seeing I think all of you that are familiar with Medicare enrollment know about the Medicare Online Enrollment Center, the OEC. This is it when Medicare beneficiaries log into Medicare.gov. They can shop, they can put their zip code in, and they can actually shop for all the Medicare products that are available to them in their area on the CMS portal. And they can enroll there in your health plan. If they select your health plan, they can enter their enrollment application, and that enrollment application is sent to the plan through the CMS Online Enrollment Center, the OEC, which is now a real-time process through an API that CMS has provided. You can still also go retrieve those applications in batch file, but that's another source of incoming enrollment applications. And then, of course, there's always the old-fashioned paper app. People can still fill out a paper enrollment application and submit it to the health plan, mail it to the health plan, and in some cases, agents are filling in paper enrollment applications and submitting them. And in that case, those need to also be intake into your enrollment system. So that presents a challenge of thoroughly understanding how do we receive enrollment applications, who's sending them, how are they sending them, and do we have the systems and processes in place to make sure we're intaking all of those applications from the Medicare beneficiary on the day that they complete their enrollment application. Another challenge that we face that the plan has to be sure to address, as all systems, as you know, are going digital. There's huge initiatives in most large health plans for digital transitioning to digital technology, to digital solutions. And that also pertains to Medicare Advantage enrollment processing. The biggest thing is that we need real-time cross-system integration. So when a person enrolls in a Medicare plan or disenrolls, or their coverage changes for some reason, that needs to be updated correctly in all of our core systems. So we need those real-time interfaces to the downstream core systems at the health plan, the claim system, the PBM, to make sure, which is critical in any system, but even more critical with Medicare, is is that pharmacy integration to your pharmacy system. So if a person enrolls in your health plan, we need to make absolutely sure when they go into the pharmacy, they're able to get their script. And the coverage is all there, it's all in place, it's all been updated through the PBM system. So we're not running into lack of delivery of services in the pharmacy. All of that requires real-time data interfaces. We also have, when we're enrolling a Medicare beneficiary or making any changes to their enrollment, we need to do eligibility verification with Medicare. We need to verify Medicare requires the health plan to verify that the person is eligible for Medicare, that they have Part A and Part B. We need to know what their coverage is, if they have continuous coverage or any breaks in coverage for Part D, if that applies. And now that is all done real time. Again, CMS has provided a real-time API connection directly into the Marks Medicare system at CMS that you can instantly verify Medicare eligibility when a person is processing or wanting to enroll in your plan. And then I already mentioned that the real-time data validation across internal systems in CMS, just to summarize that, again, this is all, needs to be done in most cases same day, and with the batch files with CMS overnight. But this isn't a days-long process anymore. This has to happen pretty much real time when you get the enrollment application. So when the enrollment application comes into the system, you want to be able to validate Medicare eligibility. Well, number one, you want to receive the enrollment application and you want to verify that it's correct and it's a clean app. You want to be able to verify that they're eligible for Medicaid instantaneously when you enter that app. And then you need to do the validation when you finish processing the app across all your systems. So, of course, our focus always has to be on the customer experience. We're in business as health plans to serve the beneficiary, in this case, the Medicare beneficiary. And enrolling in the Medicare plan is the first contact, it's the first experience that a Medicare beneficiary is going to have with our plan. So it's imperative that our Medicare Advantage and Part D enrollment experience is as smooth and efficient as possible. So because we want to make absolutely certain that Medicare beneficiary is in love with our plan from the first time they log into that member portal or talk to our agent, that the entire process is simple, it's clear, it's smooth, it's efficient. And so right off the bat, that Medicare beneficiary is thinking, wow, these people know what they're doing. I think I'm really going to like dealing with this plan. And when that happens, then we've set the tone to retain that member and keep them happy as our Medicare customer, as long as they're enrolled with our plan. So, and again, this is as the newer generations now of Medicare beneficiaries, are becoming more and more sophisticated. They're, 10 years ago, or even, as time goes on, Medicare beneficiaries are becoming more knowledgeable about technology. They're comfortable with technology. They understand how things work, and that increases their expectations that when they're dealing with Medicare, if they're dealing with a Medicare Advantage plan, that it's a smooth, simple process. And that's easier said than done, because all of you that are familiar with Medicare Advantage, either working in a health plan or actually have Medicare, like some of us do, it's not a simple process. It's not a simple process for the Medicare beneficiary, and it's not a simple process for the Medicare Advantage health plan. So we can make it as straightforward as possible, but that's something we always need to bear in mind when we're dealing with these systems. And of course, the other thing is that because Medicare beneficiaries are becoming more and more experienced and comfortable with technology, they're expecting that. They're expecting self-service. They They expect to be able to enroll in the health plan online. They expect to be able to make changes. They expect to be able to check their eligibility, change their address, get a new ID card if they need to. That is needs to be available in our systems, and so that's always remembering the beneficiary is critical. And when I worked at the health plans and then also as working as consultants, I always make sure that when we're considering processes and systems and talking about how things are going to work, I always make sure we say, how is this going to impact the beneficiary, our member? How are they going to see it? What are they going to think about it? Is this going to be easy for them? Does this make sense? That we always need to remember, how does this impact the customer? Technology, as I've talked, as you've probably noticed going along, is that there is technology available, and all of these processes, particularly around enrollment and eligibility for Medicare, have evolved tremendously over the last 10 years, and there are a number of new innovations that are supporting that. Of course, an awful lot of that is CMS is becoming more and more sophisticated. A lot of that was driven by the implementation of the Affordable Care Act, with all of the systems that needed to be put in place at CMS for the ACA, and not all of that automation has currently migrated over to the Medicare side at CMS, but the Medicare side is becoming more and more sophisticated. Many of you are probably familiar with Medicare's Beneficiary in the Cloud initiative. That there's an awful lot of that already in place and happening on the Medicare claims side. On the enrollment side, most of you should be aware that we can now receive the Medicare enrollment applications from the CMS Online Enrollment Center electronically through an API. We don't have to log on and get a batch file through HPMS anymore. Most of you should be familiar with the batch eligibility query, and batch eligibility query response is now available real time through an API with CMS. So even, CMS, the government, is moving more and more towards automated technology. So introducing these new capabilities to the plan can differentiate and personalize your health plan. People will recognize your plan based on how you look on the web and electronically, and how they receive their communications. I mean, I go on because what I do is I log into health plans. I log into health plan Medicare websites all over the country and just see what they look like. How do they look? How does it work? Does this make sense? Wow, that's really cool. Maybe we could use that in our plan. I go in and log on to Medicare.gov, put in a zip code, and borrow. In my case, I can use my own Medicare ID number, but because I'm old enough. But if not, you could still shop before you actually need to put in a Medicare ID number. You can put in a zip code. You can see what's on Medicare.gov. You can look at all the other plans. You can look at what their information looks like compared to your information. All of that is critical to leverage the technology and differentiate you from the other health plans doing Medicare in your service area. So the key direct benefits, of course, of technology is you can increase performance. You can eliminate manual intervention. And I use the metaphor, I compare processing enrollment transactions to processing claims. It's not that different. If you look at a Medicare enrollment request is a Medicare enrollment request. There's one. They're in Chapter 2. It's a standard form. CMS creates the form. You have to use that form. Every beneficiary has to fill in the same fields on that form. It's not unlike, so it's not much different, than a 1500 claim form. The enrollment application is the same for everybody, and you can automate the processing of that enrollment application just like you can automate the processing of a clean claim. If a clean enrollment application comes in the system, I've worked with technology systems that can to use the same analogy, we're not adjudicating claims, but we could say we're adjudicating an enrollment application. If a clean enrollment application comes in the system, your technology should be able to process that enrollment application without any manual intervention, from receiving it into the system all the way through submitting the enrollment application to CMS on the batch file at the end of the day, getting the transaction reply report back the next day, confirming that the enrollment has been accepted as submitted, updates their status to enrolled in your system, and automatically sends them the enrollment letter and updates your downstream systems. And you can reduce the time and cost of processing apps and increase your accuracy and compliance tremendously by using automated validations. And also it's much more scalable. So many of you I know have traditionally had to bring in temporary employees during the annual enrollment period every year because the volume increases dramatically during that period. You're processing both enrollments and disenrollments because you're trying to enroll as many people as you possibly can. Your process is in many cases trying to get those people to switch from the other plan to your plan. That other plan's doing the same thing. So what's that mean? That means they're being disenrolled from your plan. So AEP has huge volumes, and many plans have to bring in temporary help because their processes aren't automated enough and have so much manual intervention required. If you automate, you can virtually eliminate all that manual intervention. And the only thing your processors or enrollment specialists needs to look at are the exception transactions that your automated process can't figure out. Just like a claim system. If your technology on a claim, the codes don't line up, the diagnosis doesn't match the ICD codes, then the system will automatically pop that claim out for a specialist to look at. An automated enrollment system should do exactly the same thing. So you can prove the overall timeliness, accuracy, and of course compliance, which is absolutely critical. And if you do all of this timely and accurately, you're going to improve your customer service. The benefits of an automated MAPD enrollment and operations processes, I think I've probably already talked about these, but we're going to improve our beneficiary satisfaction right off the bat. This is their first introduction to the plan, and the smoother and better this works, the more that beneficiary is going to be impressed with our plan. We can increase enrollment requests throughput. So instead of processing, taking 20 minutes, I've worked with plans that are taking 20 minutes to a half an hour per enrollment application to get them processed in the system. I worked with one plan when we went from 23 minutes to just under 3 minutes, to like 2.5 minutes per application. And we were still improving that because we were automating the election period determination. If we utilize those CMS API interfaces, I already talked about those. We can receive the CMS Online Enrollment Center applications electronically, and we can validate the Medicare eligibility using the real-time BEQR API interface. And if most of you that are familiar with Medicare, a few years ago, and not that many years ago, when I've been working with health plans, when I was at the health plan, and then when I first started doing consulting with Medicare plans 10 years ago, plans got very, very few enrollment applications from the CMS Online Enrollment Center. I worked with million-member plans, and they might get 1 or 2 OEC apps a week, if any, but they still had to go in every day and check. That volume has increased tremendously because CMS is actually promoting the Online Enrollment Center. If you're a Medicare beneficiary, like I am, I get emails from Medicare during AEP saying you can go to medicare.gov, and the emails actually come with the link that take you to medicare.gov. You can see all the plans, you can shop, you can pick which plan you like, and when you pick the plan you like, you can enroll in it on the CMS OEC. So the volume of OEC applications has increased dramatically in the last 2 years, and I would expect it to continue to increase. as time goes on. And then of course, with technology, we can ensure better compliance because all the CMS regulations have all those transaction timeliness that's required, the actions and the letters. We have to process a CMS enrollment application within 7 days of receipt. We have to send the letters. It depends on which letter, but anywhere from 5 to 10 days from receipt of the TRC. If it's automated, you're not waiting days. You don't even have to worry about these timeliness transactions. You're processing your enrollment applications that day. You're sending the daily transaction file to CMS that night. The next morning, you're getting the transaction reply report back. If the membership is accepted by CMS in that file, the next morning, you're updating their status to enroll, and you're sending them their letter that day. And so worrying about, oh my God, we've only got 1 day left, or at day 6, and this hasn't been done, should virtually be eliminated with adequate and working technologies and process to support it. So overall performance management just increases dramatically, which also, of course, as I mentioned earlier, directly relates to your costs per transaction. They'll be much less. So training and development, of course, is critical anywhere. And it's just as critical for Medicare Advantage enrollment and eligibility as it is for any other process that we do within the system. So, we need to effectively manage, track, and achieve the learning goals of our team. So making sure everybody's up to speed, that we have training in place, that when Medicare regulations change, we have updated training sessions and tools and user aids to make sure we're current at all times, and that we're keeping track of that. Who took which classes, were they there? So when we get audited or whatever, we can also show that we're adequately training all of our staff members on all of the regulations, so we can demonstrate that they've been trained. And then not only can we demonstrate that they've been trained, we can also demonstrate that we have the processes in place to monitor that people are doing their work as required for compliance. So we have the systems in place to identify any gaps. And if there's errors, or a particular processor keeps making continuous errors, we're able to identify that person. We're able to give them follow-up training, enhance their training, track their performance. And if it's in a case where it's just not improving, unfortunately, we may have to put them on a corrective action plan and help them improve. And if they're not, we may unfortunately need to replace them. But we need the processes in place to do that. And if we do it well, then we're going to be retaining highly skilled, trained employees. And so we have all of these programs in place to do that. We automate and scale the training to meet our needs. So like I said, if there's a new regulation comes in that, like 2 years ago when the ESRD eligibility requirements changed, there needed to be very specific new training about ESRD. So our enrollment processors knew that they no longer have to worry, does this person have ESRD or not when they enroll? We need to know if they do, but we can't deny the enrollment if they do. And then we have, of course, all of the systems in place to track and monitor and report the effectiveness of our programs and training. And all of those of you that are familiar with the 7 principles of an effective compliance program know that monitoring and auditing is a critical part of an effective compliance program. And training will just facilitate that and make sure we have documentation of that. In that, the goal, of course, is to have no adverse beneficiary impact. We want to eliminate beneficiary abrasion by these programs. So one alternative that many plans and a growing number of organizations have begun to recognize the value of enrollment and eligibility outsourcing. And if you here at Catalyst, we're able to help you with this. We offer outsourcing. We're more than happy to talk to you about that and see if there's any opportunities. So we can not only help you with your internal operations if you're going in that direction, if it looks like it would make sense to outsource, we can certainly help you do that. And enrollment is a perfect opportunity for outsourcing because, like I said, it's a transaction process. It's not something like, care management or, the functions that need a lot of beneficiary interaction and medical interaction and so forth. Enrollment is transaction processing, and it can be very easily administered in an outsourcing environment. And of course, one of the advantages of outsourcing is economies of scale. We're processing large volumes, so we're able to do it much more efficiently, much more effectively at a lower cost per transaction. So that's something that definitely should be considered and looked at. This is a commodity process, and it's an area that we can definitely help you deal with and address and offer that service. Organizations, well, here I basically just said that, but outsourcing costs less than running an internal MAPD enrollment department. It provides greater scalability. You don't have to worry about hiring very expensive and training temps during AEP or whatever. Your BPO, in this case, your Catalyst BPO, handles that and takes care of the scalability. Also accommodates your growth because hopefully you're growing and getting more new enrollees every month. If you're fortunate enough to be a 5-star plan, your monthly enrollment volumes, of course, or daily enrollment volumes are greater year-round because you eliminate a lot of those open enrollment restrictions if you're a 5-star plan. So another reason to have these adequate systems in place to provide that level of quality. The outsourcing provides a better customer experience. It's always consistent. The tools are available. The people can see it. They can get the work done quicker and more accurately. And we deliver increased quality control and compliance monitoring. Again, just because that's what the Catalyst solution, outsourced solution does. We're processing these transactions. That's what we're focused on. That's what we're monitoring and making sure it's done as best as it possibly can be. So then metrics that support MAPD enrollment. This is all, once all this is in place, we need the metrics in place. Like I mentioned earlier, it's not only a compliance requirement, it's needed to run the plan well and to provide the absolute highest level and quality of service to our beneficiaries as we possibly can. So we're monitoring every day in reporting. We're monitoring the number of enrollment requests we receive. We're monitoring the disposition of those applications. CMS requires us, like I said, to process them or disposition them within 7 days. Every single enrollment request that comes into the plan needs to be accepted, denied, canceled, or temporarily incomplete. If it's put into an incomplete status, it has to be completed within 21 days. And so all of that needs to be monitored, needs to be tracked, needs to be reported. And that's this next bullet, the time from receipt to disposition. And if we're going down that automated happy path I talked about, from having a fully automated flow from receipt of the application to acceptance of the application and enrollment from CMS, that should be 24 hours. App comes in today, processes overnight at CMS, they're enrolled tomorrow. And that time from receipt to disposition, we shouldn't, our measurement of 7 days to process an app should be 99% on a daily basis if we're doing this correctly. That the same time from receipt to disposition, time to process the request should be 24 hours. Then individual productivity, how are our processes working? If we have enrollment processes or enrollment specialists whose performance is lagging, we identify that and we help them. We find out what the problem is. If it's a training issue, if it's an understanding issue, if it's a personal issue, whatever it is, we identify that, and as management, we work with that individual to make sure they're productive as they possibly can be. We can virtually eliminate, we want to eliminate CMS avoidable rejections. I won't get into all the detail here, but those of you that are familiar with MAPD enrollment know what an avoidable rejection is. You don't want them. You want to submit your transactions timely and accurately to CMS. So you need the people and the systems in place to make sure that that happens. And then you need to just be tracking overall production and what's going on with your Medicare plan or plans. You want to know how many new enrollments have we processed today, week, month, year to date, how many disenrollments, so we know what is our membership growing, is our membership dropping? If it's dropping, why are people disenrolling? How can we fix it? If we're enrolling every day, you know, where are those enrollments coming from? Which one of our sales processes are working the best? And that also relates to sales agent metrics. If we're using independent sales agents, we need to be monitoring sales agent performance and metrics as well. Analytics, of course, everybody's all about analytics more and more these days. And we can use our enrollment data just like any other data to focus on how we're doing with overall membership in our Medicare Advantage plan. We can make sure, you know, our processes, not only are our processes working correctly, but are we being successful if we're doing marketing campaigns, identifying areas for opportunities, looking at the specific populations, how are we doing? Is a specific population growing? Is it declining? Is it because of why? Is it because of our premium? What are the competition doing? We're comparing it to that. We're looking at our health engagement services in the communities that we're striving to serve, and our mission and vision and overall strategy. We're looking at compliance. Are we always in compliance? Are we making sure all of our systems are in compliance? Are we doing this as efficiently as we possibly can? What's our cost per transaction? Is it tracking the budget? How does it compare to other plans in the industry? We use the various industry cost reports that are available. Where do we have the systems in place to make sure that the members are enrolling in the best package, the best benefit package for their particular circumstances, that they can afford and receive the absolute best services in their area and with their budget? Are we tracking data to improve quality care? Are we increasing member confidence and satisfaction? And are we reducing wasted marketing costs and member abrasion? So are our marketing programs being effective? Are we getting the targeted audience? All of that I mentioned in those bullets up above. And of course, are our beneficiaries happy? We want to be sure they're happy, that they're getting the care in the right place for the right premium that's meeting their needs. So just to wrap up, the building blocks of any successful program, I've been around a long time. We always talk about people, process, technology. Same thing. We need the people. They need to be trained. They need to understand. They need to know the programs. They need to understand the CMS regulations, the complexities, those challenges. We need the processes to process these transactions as best we possibly can, and we need the technology to support that. And with all of that, when we have the staff, then we need the metrics and the key performance indicators and the reporting and the monitoring to make sure we're maximizing our beneficiary satisfaction. Enrollment is the first Medicare beneficiary's encounter with the plan. That was when I opened back at the beginning. First thing a member sees is going in to process an enrollment application. Is it an easy process? Is it clearly explained? This is where their experience with our MAPD plan starts. The many MAPD plans focus must be on delivering affordable health care that improves the lives of their membership. That's true of any plan, and anything that is not a core business, like enrollment processing, these commodity processes like enrollment, you should consider outsourcing to a trusted partner like Catalyst Solutions. We understand this, we understand the beneficiary requirement, and we can help you do that. In our BPO relationship can not only build a collaborative partnership, we can also help you meet your mission, because our mission is to support you and be as successful as you possibly can in changing healthcare, making it affordable for the member and making the health of all those members better. So that's the goal. And we have to remember that all starts when the person enrolls in the plan. So that's why this is so critical. So thank you. And if you'd like more information, you can email us. The contact information is all here. We will make this available to you.